We're going to introduce our keynote speaker, who we are proud. We appreciate her coming on. Dr. Nina Anderson is founder of the TOVA Healthcare. She founded a community-based sickle cell specialty treatment center in Delaware. She created the James Foster III 5K run and walk and the TOVA awareness of sickle cell disease anemia. Today, Dr. Anderson will talk to us about her experience working with the sickle cell disease community and her efforts in the education, awareness, and prevention. So ladies and gentlemen, we want to welcome Dr. Nina Anderson to the floor.
Woo! Hey. Hi, guys. Hi. I was listening to your conversation and your dating questions, but I didn't hear a question that asked, what is your sickle cell trait status? I think that it was very important to ask that question, especially if you're of childbearing years. So I would be interested to hear what the contestants would say to that. But anyway, thank you so much for having me today. I am a senior research fellow at Delaware State University. I'm very sorry that I can't be on campus right now due to COVID. Prayerfully, I'm trying to keep my patients out of the emergency room and hospital to flatten the COVID curve. And I'm thankfully able to share that I have not lost any of my sickle cell clients to COVID. 2 have developed COVID, had to get transfused, developed acute chest, but they are still with us. So I'm very grateful for that. It's been a long year, and prayerfully, we're coming down to the curve. So I haven't had a chance to meet with some of you who are on the Love REDefined, and you see I have red on today. I'm always in red because I think it's very important for the community to know that I embrace sickle cell. I devoted over 20 years of my career doing this, and I love what I do. I love taking care of the sickle cell community. And to me, Love REDefined celebrates hope. It celebrates innovation, celebrates sickle cell awareness for new treatments to improve the quality of life with those living with sickle cell, and therapies to develop a universal cure. And so I agree, education is very important, and the work that you do is very important at Delaware State University, because you guys are the future. You're the future workforce. You're going to be on the front line advocating for populations who are most vulnerable and need more resources and services. So most and foremost, I am a public servant. I've been down at Delaware State for 6 years. Maybe some of you don't know me, have seen me. But during health fairs, my staff and my team would come down every year to screen students free of charge for sickle cell trait. I have a contract with a biotechnology company, which within 5 minutes, you can know your sickle cell trait status with just a prick of your finger. And every time we come down to the health fairs, we completely sell out of use up all of our kits. And we usually screen between 50 to 75 students that come over to our table. And you'd be surprised that some of the students do not know that they carry the sickle cell trait. And they are very, very thankful for us to at least revisit that and understand what the implications are, especially if they have children and with exercise. But a little bit about myself. I'm from Delaware. I grew up in Delaware. I graduated from John Dickinson High School, and I went to the University of Delaware. Don't shame on me. But I do have 2 siblings of mine that graduated from Delaware State University. My sister did, and my brother, Philip, was a star football athlete under Coach Collins when they won the MEAC championship in football. So I'm proud to say that some of us went to UD, some of us went to Delaware State, and some of us did the School of Hard Knocks. But we have embraced the university, love the work that you guys are doing, and I have been trying very hard to give back to the university in many ways. But I want to say that I consider myself, this is Women's History Month, a social entrepreneur. And a social entrepreneur develops, funds, and implements solutions by creating business model that puts the mission of their business at the center and are accountable to the community. What I mean is that TOVA is in Hebrew means good. No, I'm not Jewish, but I am a spiritual person. And I really felt that that was missing from the patients that had sickle cell, making sure that they had access to high quality care, making sure that when they went to the ER, they weren't just considered a drug addict. They were there because they had pain. And maybe though the doctors or the nurses couldn't physically see, or they don't look at them like they're in pain, they have to honor their personalized care plan and give the appropriate medication in a timely fashion so that they can manage their pain comfortably. And so I looked at sickle cell, even though it was a rare blood disorder, affects a disadvantaged community and is under-resourced, as an opportunity to grow in a space that was not saturated. And the way I did that, because I didn't have a lot of support from the hematologists here in Delaware, because nobody wanted to partner with me, because they said, well, you can't make any money taking care of these patients, and we don't have a lot of resources for it. But I took the leap of faith, and I leveraged a partnership with Johns Hopkins University, and I launched a satellite clinic with telehealth technology 6 years ago, before COVID. And so I created a model in which I could have my patients have access to the services at Johns Hopkins here in the state of Delaware, first using phone calls, but then we switched over 6 years ago to a telehealth platform, which we now call Zoom, but back then it didn't really have a name. And from this model of care I developed, I won Delaware Woman-Owned Business of the Year. It wasn't because of the income I was able to generate. It was the potential of the model to really change the landscape in which we provide services for people with sickle cell, and especially adults. And this model of care, which is now called Project Echo, trained over 175,000 healthcare workers across the country, across the globe. And it reaches as far as India, where they have had over 255 tele-echo sessions, reaching 78,000 spokes a year later. I want you to think of sickle cell as a global disease, and the potential opportunities and partnerships that you can leverage across the country. And so, as I was sharing with you, that sickle cell disease, I hate the word disease because that sounds so negative. I was challenged to talk about the stigma related to sickle cell. But most importantly, sickle cell affects all races. And it's a blood condition that not only affects African Americans, but affects all people, because wherever there is a population of people that have survived malaria, you're going to see patients with sickle, or people with sickle cell.
Hi, I'm Dr. Nina Anderson. I'm the Executive Director of TOVA Community Health. I found out that little Jimmy had the sickle cell trait at about age, he was about maybe a month old, actually. The doctor called us back in to have the test done. So we were advised that they were going to do the test. So we brought him into the center and they did the little foot prick. It took me about 15 minutes. And I don't know if we got the results that day or we were called back later, but we got the results basically stating that he had the sickle cell trait. Now that I know my son has the trait, it's important to me because it's important to educate him. So I've told him, explained to him how important it is to, when he meets people, if he's interested in dating at a later age and he wants to get married, that it's important to find out their status. We talk about what's the AIDS status, what's your status. He needs to know what's their sickle cell trait status, because I think it's important for them to know if they decide to have children. That's a discussion that needs to be had, because it's possible that they may produce a child with the full-blown disease. It's really important to communicate with their teachers and their coaches if they're active in sports. to let them know, to look for signs, if they don't know if the child has sickle cell trait. For a child who may be going to the bathroom a lot, or if they are complaining about having pains in their backs or their back or their legs, that's important. At times, I know coaches could be very hard on the players to push, but look for those signs. If a child says they need a break, please allow them that break, because a child with sickle cell trait could possibly collapse on the ground and possibly die. So it's important that, the families communicate and be transparent to share this information. There's nothing to be ashamed about. And also educate your children, if you have a child with the trait, to share that information with their spouse or the person that they're dating before they have children. If they're educated on this, these are all different things that we can do to break the sickle cycle.
And we are in the middle of COVID, yes. And I get tired of looking at the numbers because it always makes me a little nervous. But yet there was been 29 million cases of COVID in the United States right now. They have vaccinated over 100 million people. And unfortunately, 532,000 people have succumbed to COVID. But I want you to understand that malaria, there have been over 500,000 deaths that occur every year and 200 million cases of malaria. Malaria is one of the oldest pandemics that have almost wiped out the continent of Africa, because that mosquito, if it penetrates into the host cell, it can cause severe damage, neurological damage, and lead to death. But people that carried the trait or had the disease actually had some protection and were less likely to die of complications of sickle cell from malaria. And so they passed those genes on to their children. And so in the United States, about 100,000 people live with sickle cell anemia, but across the world, 300,000 babies are born each year. And I see that you are donating proceeds to the Nigerian Foundation. It's estimated about 50,000 babies are born every year in Nigeria with sickle cell anemia. We know that 1 in 12 African people of African descent carry the sickle cell trait. That's about 3 million people in the United States. But in sub-Saharan Africa, it's almost as high as 25% of the population carry the sickle cell trait. That's 5% of the world's population. That's almost 5.5 million births annually.
My name is Beth, and I have sickle cell.
You have the sickle cell trait.
That's what I meant. I have the sickle cell trait.
I'm her mom, Beth McCloskey, and I have the sickle cell trait. Right after Beth was born, September 24th, 1993, I brought this wonderful child into the world. And it must have been a couple weeks later, and I got a piece of paper in the mail, and I opened it up, and then it, it informed me that, the blood test had come back, that my daughter had, tested positive for the sickle cell trait. And my first reaction was like, this can't be right, because I'm Caucasian, And so I called the number, and I, explained to the the person on the other line, I said, this can't be right. I said, I am Caucasian. And she said, this is her exact word, "Oh, honey, it must be a mistake. Just bring her back in and we'll retest her." And so we went back in, we retested, it was positive again. And she's like, "You need to go to your pediatrician." So I took her to the pediatrician, and he's like, "This can't be right, So he tested her again, third time, and positive. And he's like, "That's it. I'm testing you. I'm testing your son, Brian." And so they came back positive. And he's like, "This is the first time in 35 years of practice that I have had a Caucasian family with sickle cell trait."
Daughter.
Yes.
When did you find out that you had the sickle cell trait? Was this story told to you?
Basically, that's kind of how it was told. It was probably from my brother. He's always been very adventurous, wanting to skydive, scuba dive, whatever. And I showed the same interest, and that's kind of how I found out, was by saying, "I want to swim with the dolphins, and I want to swim with the fish," and "Hey, you can't because you have sickle cell trait." So that was kind of, I didn't really know what it was, but I kind of found out from her through that there was limitations because I did have the trait.
At first he didn't. I actually started doing a lot of my research on my own, and I found my mom is Italian, and her family comes from Sicily, and so I had read someplace that it was it was rooted in Sicily, that it could be rooted in Sicily. So and then I guess he did a little bit of research and confirmed that my findings also.
It's almost like a background check. You have to figure out, whether or not they have it, because it can be passed on. So there's extra worry. I know, obviously, she passed it on. So now it's me next. So now I have to make sure that I'm more careful with finding, in a significant other, whether or not they have it or whether or not, because it can be passed on to children with the trait. I mean, it's always just kind of like a joke. I never really, they kind of laugh it off like, "Oh, okay." And then I have to explain that I actually do have it and that it's kind of an actual, worry for me. Most of them don't really know what it is when I ask about it. So I kind of have to explain background, and most of them don't know.
I mean, at first when I found out, I actually cried. I thought I had given my daughter this terrible, disease, my son this terrible disease.
Absolutely.
And here to find out it was just the trait, which, but still it was devastating when I found out.
Oh, I didn't know that. Did you know?
No, I did not know that.
Okay,
Mm-hmm.
well, now I know.
So when we talk about erasing the stigma in the Black community about sickle cell, there's historical reasons behind it. And when people say, "Well, why did you choose sickle cell?" And I don't have that love story, because nobody else wanted the job. It stayed vacant for 6 months 20 years ago. But when I go back to my upbringing with my family, my parents, my mother was a nurse, my father was a teacher. They said, if you get your education, you go back and you serve your community. And so this was a community that needed care, and they needed someone that would provide a more holistic approach to their care. And so I was so grateful to fill that gap. But I also want to say that sickle cell is one of the most studied genetic disorders, but one of the least funded. But that is changing now. When I first started, and I would wear red and I would go out and talk to people, they would say, wow, why don't you get a job in something else? Like, why are you specialized in this area? Because is a patient population that needs good care, and there has to be somebody to fill that gap. But we have to be honest that there's some historical reasons behind there's such a stigma. And one of the things that I found along this journey, especially when I screen and I go out to community, asking people, what's your sickle cell trait status? Do you know, can we screen you for sickle cell trait? That in the state of Delaware, at one large chemical company, which I won't say the name, Black Americans were more, they screened for pre-employment Black Americans for sickle cell trait because they thought they were deemed more susceptible to certain chemicals in the workplace. And that actually caused a lot of controversy in the community as well on a legislative side. And so when you think about that stigma, it still carries on today. Some people worry that their insurance premiums will be higher if they have carry the sickle cell trait or have sickle cell disease. Or if they're an athlete and they carry the sickle cell trait, will they pass me over for someone that doesn't? You know, and so these concerns and these stigmas still prevail in the community. And the other is that, you know, sickle cell, people with sickle cell living longer. And I want to say that 2 years ago, my oldest patient was 83 years old when he passed away and lived a full life. And so I'm very grateful that I have a population of patients that are in their 60s. And one, Leslie, who's actually my cousin, she's also a DSU alumni. She retired as a school teacher. She did 30 years in the Delaware school system, is about 2 years from getting her Social Security check. So she has a lot to share about her journey. But 30% of adults live with chronic pain. And I would say about a third of my clients suffer from depression. It is a very grueling, debilitated chronic condition that as they get older, the complications of having these recurrent crises causes chronic kidney disease. It can cause bone-on-bone flattening of their hips and their shoulders, degenerative disc disease, problems with the retinal vessels in their eyes that could possibly lead to blindness. Anywhere the blood circulates in the body, there's going to be some problems. There's going to be some damage or issues. But I want to say that I encourage all of those who have carried the trait and those who have sickle cell to continue to tell their stories, because that's really important, how we change the landscape of understanding about sickle cell and sickle cell trait. And the social media world has really blown up and has really made sickle cell more visible. I just saw 1,000 posts about Sickle Cell Lives Matter, 1,000 sickle cell awareness posts, 32.6 thousand posts hashtagging Sickle Cell Awareness Month. And so I want to say that the work that I have done has really tried to plant seeds and to harvest projects with the university, research programs, and programs to engage the community about sickle cell. And I still have an office on the second floor. I'm in the psychology building in Delaware Hall. I do have a website as well, which is nanderson@desu.edu. So please, if you have any questions, please reach out to me. I also want to say, as you said, REDefined, and I've always wear red. Red means love, it means strength, it means passion, and it means determination. So I encourage you all to continue to wear red, rock red. It definitely champions sickle cell, improves the awareness. And also one of the things that my company did was I trademarked Sickle Cell Lives Matter. And so I sell t-shirts, and the proceeds go to help with my primary specialty care clinic. We provide a lot of services and programs to our clients that have sickle cell. And all of these things help to champion the cause. It's a conversation starter. It's a way in which we can be proud of who we are, embrace sickle cell, embrace if you have the trait as well. So in closing, I just want to say that communities that plant seeds will reap a harvest. And I encourage you all to be innovators, continue to push the paradigm forward, to have these conversations and to talk honestly about sickle cell. Let's break that stigma as we continue to move along. Good luck. And I wish you all the best in your endeavors and your careers. And if you want to reach out to me, please do so. And you can also go to my website as well at www.tovacommunityhealth.org.
Well, thank you. Clap it up for Dr. Nina.